me welcome to the stage Ellen Badinelli, the founder and CEO of ScanAvert, to present ScanAvert. Welcome.
Good morning, all. And we have a few technical requirements, so just bear with me. Thanks so much. I am the founder of ScanAvert, as you just heard. And ScanAvert is a mobile service that alerts consumers to harmful substances in their food products just by scanning barcodes. So I'm going to turn on my phone. Our subscribers register a health profile for themselves. Where's my Elmo? There we go. Okay. So here's my icon on my handset. I open it up. Now I'm prompted to scan a barcode. I can enter a barcode manually or enter my diets and allowances. So I'm going to do this real quick. I'm going to scan a barcode on a product. And this is incompatible to my Adderall. Now, I just made this profile up with some of the common drugs that we find that our members actually select in their profiles. And I'm going to get to that in a few minutes and show you how we do that. So here you can see there's substitutions of the product that I can have. And I can even zoom on the picture so I can find it in the store aisle more readily. But I want to go back to the information that we deliver, which is ingredients. We list them. The bad ones are right at the top, so you can see them, and the safe ones aren't. So it's very user-friendly. Now, one of the things that we recognized when we started to do this was that our subscribers have many different filters for their family. So they create a profile that includes any dietary restrictions, any allergies or illnesses or diseases or conditions, as well as anything in the nutritional box they want to limit. So I'm just going to scoot over to my laptop here. And I can do this from my handset as well while I'm on the go. I can go to Edit Diets and Allowances. And you can see diets and prescriptions, anything I want to do. This is bigger, so I'll go over here and do this. And I can do it on a website. Because it is it's a web-enabled app, there's interoperability between any device that you choose. So here you see the same thing on my handset that you see here, but it's a little more user-friendly. So I'm going to go to Diets. And you can see here are some common diets we list. Gluten-free is one of our top dietary profiles. And as I scan over them, you'll see all the terms used to indicate the presence of that particular allergen or dietary restriction, and we even quote the source at the bottom. And in this instance, it's Food Allergy and Anaphylaxis Network. FAAN is the leading organization towards the food allergic consumer and labeling issues. So they provide us with all the terms used in the big 8 food allergies. And you can see some of the other terms we use. I'll go back to gluten. There's the source at the bottom here, gluten intolerance group. For illnesses and conditions, we tell you to check your dietary recommendations, go to My Allowances, and to discuss this with your physician. So that covers our diets. If you don't see a diet here that pertains to you or your family, you can even create your very own custom diet. So this really has served the purpose of many people who are vegan or vegetarian. They can put in whatever terms that are acceptable to the diet they want to follow. I can go to my prescriptions, and I can add a particular prescription. As you populate it, it gives you suggestions based alphabetically, and you just click on one. We get our prescription data from patientassistance.com, which gives us the prescription as well as all the contraindication information. And then we also provide you with an opportunity to limit your allowances. So here I have my carbohydrates set as a maximum of 25 grams per serving. I can limit sodium milligrams. I can have a minimum requirement for my vitamins or zinc or iron or even fiber, anything I choose. So now I'm going to go back to my, follow me over. Okay. Now, I'm actually going to change my profile, as I showed you on the And I'm going to, let's see, add another diet. So we found that a lot of families use our service, and again, not just for themselves, but for many people, and pregnant people, pregnant women, obviously, find our service really useful. So I'm going to actually go through what it's like shopping for a pain reliever when you're pregnant. So if you see how clearly we alert this to you, now this is from the label, and there's an allergy alert. You really have to scroll very far down to find the text that says, do not take if you are in your last trimester of pregnancy, because this may cause complications during delivery or problems in the unborn child. Scary statements. And yet on this box, even if you were a really informed consumer, you could never find it. So now we're going to head back to my, my other screen, and I want to bring up something that I think shows some of the data that we collect. So let's do this very quickly. Oops. Now, some of you may remember that Harvard School of Public Health released a rise of psychotropic drugs among women in November of 2011. The same study was then released by Medco, March 15th of this year, reporting the same findings. We found this in 2009 just based on our beta test users, and we spent that much. Our subscribers tell us what is important to them, and we get all this information on their prescriptions because they need for us to determine what's compatible or incompatible. But this is really an alarming trend, that Adderall still, we see the same trend, although now the leading psychotropic drug is not Adderall, it's a competitor. If you want to know that, do business with us, and we'll tell you. One of the other things I think is interesting is that this is our top demographic diet, MSG-free, gluten-free, and pregnant and breastfeeding. And the last statistic I really want to show you is the allowances. You can see above all the others, calories. People are monitoring their calories followed by carbohydrates. So if you give people simple to use tools, they will embrace them and they will use them. And one last thing I did want to show very quickly was that we have become something of an authority on recalls. When you log on to your handset for any product that's recalled, you immediately get an email. We started to receive emails from all over the public, people that aren't our members. So this is kind of interesting to me. We basically have this alert from someone who is not our member, but we advise them to get to the emergency room. Am I going to die? Pretty scary stuff. We also noticed that companies actually have been perhaps recalling their products without telling us. So here are 4 emails about Benefiber. That lets the FDA know that perhaps there's a product that's quietly being recalled. So we fulfill guidelines by alerting the public to recalls and people that aren't even our members. So thank you so much for your time. We hope that as insurers and larger organizations, you'll partner with us and build alliances that will keep consumers, who are your patients, safe. Thank you so much.